tooth number 30DO for the ADEX or CDCA exam. The steps outlined in this video are specific for the mannequin version of the exam. First, assemble the armamentarium as shown in this illustration. Note that the materials included in this illustration include specific modifications for a typodont exam. While not a specific part of the CDCA guidelines, it can be helpful to select the appropriate composite shade to help mask any imperfections in your restoration. Before proceeding to the restoration phase of the exam, ensure that you have received approval from the CDCA or ADEX examiners. It's highly likely that on exam day, you'll be required to create an occlusal extension for your Class 2 preparation. This video identifies how to perform a restoration for a slot preparation specifically. For tips and tricks on how to prepare and restore an occlusally extended or conventional Class 2 preparation, watch one of our other MyDentalKey videos on our website at www.mydentalkey.com. Whether working with a typodont or human patient, you must perform your restoration under a rubber dam isolation. Using your forceps, place the sectional matrix band interproximally. Optionally, to facilitate band placement, place an interproximal wedge prior to placing the sectional matrix band. After placing the band, place a wedge, either wooden or plastic, interproximally from lingual to buccal. Use the 3D ring forceps to place the 3D ring. Doing so should stabilize and hold the sectional matrix band in place. Collectively, this setup will help create a marginal seal as well as appropriate contour of the restoration. Before proceeding to the next step, ensure that the gingival margin is completely closed. Though not strictly necessary with a sectional matrix band setup, it can be helpful to burnish to ensure an appropriately sized contact. When working with typodont teeth, it is not necessary to use etch to prepare the preparation for the restoration. As a result, we chose not to use etch in this video. However, if performing this procedure on a live patient, it is crucial to use etch prior to using bond or to restoring the tooth with composite. Adjust the overhead light and loop light to cure safe mode. Scrub the bonding agent into the preparation using a microbrush. Apply a light stream of air from the air water syringe to thin the bonding agent. Using a clean microbrush, you may remove the excess bond that has spread beyond the preparation. In a clinical setting, you would now cure the bond after applying the bond and removing the excess. However, we found that when working with the occidental teeth, it was helpful to leave the bond uncured. Doing so helped the composite flow into the preparation. Extrude packable composite onto your glove or a clean mixing pad. Optionally, you may apply a coat of bonding agent to the hand instrument to prevent sticking of the composite to the instrument. Use a clean hand instrument to pick up a small amount of the composite. Place composite into the most gingival portion of the preparation, starting at the gingival wall of the proximal box. Note that your increment should be no more than 2 millimeters thick. Use the smallest composite plugger to pack the composite and ensure it is flush with the preparation walls and matrix band. Though not shown in this video, during the first few increments of composite, to ensure appropriate gingival seal and good adaptation to the adjacent tooth with composite placement, push your composite plugger toward the adjacent tooth. Light cure the composite for 20 to 40 seconds. Incrementally fill, pack, and contour until the proximal portion of the preparation is nearly filled. The more carefully and thoroughly you pack your composite, the less chance you have of having voids in future steps. Ensure that the gingival area of your proximal box is adequately filled. You will not have reconstructed the marginal ridge at this point in the procedure. Light cure between increments of composite. Now, apply and condense composite to create the marginal ridge. When doing so, match the contour and height of the marginal ridge to that of the adjacent tooth. Use the tip of your explorer or hand instrument to round the marginal ridge and recreate the contour of the occlusal embrasure. Carefully recreating the anatomy at this step in the procedure can save a lot of time later on during the finishing and polishing steps. Light cure the composite for 20 to 40 seconds. Before removing the 3D ring setup, it can be very helpful to inspect your restoration and make sure you're satisfied with the marginal ridge area. Make sure you've recreated the occlusal embrasure and that the marginal ridge is approximately the height of the adjacent tooth's marginal ridge and matches the marginal ridge areas remaining from the tooth structure that is unprepared. As a pro tip, it's helpful to use flowable composite for small voids in your restoration. Light cure after adding flowable composite. Remove the 3D ring with the 3D ring forceps, then remove the wedges, and finally remove your sectional matrix band. After removing the assembly, light cure for 20 to 40 seconds from the lingual, buccal, and occlusal directions. Doing so will help cure any areas that were previously protected by the assembly complex. Take a moment to inspect the restorations for voids, flash, and inadequate marginal seal. Add composite as needed. We're doing a lot of inspections here, but this is an important exam, so we just want to make sure that we don't miss any steps. Using your Explorer or other hand instrument, inspect the interproximal portion of the restoration as well as the marginal seal and occlusal seal. Use floss to check that the contact produces a light snap. If your contact is too tight or over-closed, use a contact easy and slide it down through the interproximal to lighten the contact. You can also use a number 12 surgical blade to remove interproximal gross excess in the gingival area. In the event that your contact is open, don't panic. First, remove a small amount of additional composite from the contact area using your rotary instruments. Then, reassemble your sectional matrix setup and 3D ring with a new sectional matrix band and add composite to the contact area, carefully compacting and recreating the marginal ridge anatomy. After removing interproximal excess, opening a tight contact or closing an open contact, check the contact area again with floss. Contour, remove excess composite, and perform coarse finishing of the restoration with rotary instruments. Use your finishing system of choice. Alternatives include diamond finishing burrs or sequential polishing cups of differential roughness. When using a coarser finishing burr, such as the Whitestone, you can add an anatomy to the restoration, which can be helpful for improving the appearance of the restoration. After the coarse finishing and contouring, perform fine finishing of the restoration and initial polishing. As a pro tip, the polishing point can actually be quite abrasive on the occidental teeth. Try not to exert too much pressure, as you might wear away the simulated enamel on the occidental tooth. Since the CDCA requires you to have minimal to no enamelplasty, this is something to definitely watch out for while performing your restoration. At this point, you may remove the isolation. Check the occlusion using articulating paper. Depending on your examination site, any use of rotary instruments may require the reapplication of your rubber dam. Adjust the occlusion as needed using rotary instruments, high speed with water or slow speed, until appropriate articulation is achieved. Floss up and down in the contact area of the restoration. An appropriately closed contact produces a slight snap sound when the floss passes through. Perform fine polishing of your restoration as needed with or without the rubber dam. Clean and dry the restoration using your air water syringe. Examine the restoration. Use your Explorer to check for a smooth transition from tooth structure to restoration. Ensure that the composite is flush to the cavo surface margin, that the marginal ridge is the correct height, that there is a closed interproximal contact and correct interproximal contour, and that there is no overhang. There should be minimal to no enamelplasty, no damage to the adjacent tooth, and no damage to the soft tissue. Use the My Dental Key checklist in order to check your work. Thank you for learning with us today.